Case presentation is over Bobby Boucher from The Water Boy. His symptoms. Bobby presents a range of psychological symptoms that indicate significant emotional and social struggles. He exhibits social anxiety characterized by overwhelming fear of being judged and rejected by others. This anxiety prevents him from interacting comfortably in a social setting, which is like leading to avoidance behavior where he isolates himself or relies heavily on his overprotective mother for comfort and guidance. Bobby also has problems controlling his emotion, as seen in frequent anger outbursts in response to insults and challenges from his peers and teammates on the football team as well. Bobby also exhibits behavior that aligns with dependent personality disorder, showing an overwhelming reliance on his mother and difficulty making decisions independently. And then his development history. Bobby Boucher's development history is marked by a combination of overprotective parenting, emotional neglect, and social isolation, all which has contributed to the psychological challenges he faces in adulthood. Bobby experienced a childhood as well where he was shielded from the outside world by his mother. She was overbearing nature and not only prevented him from being in relationships, but forming them as well, and not only led to emotional neglect, and it made it clear that she was the only person that Bobby could rely on. Bobby also grew up without a father figure, which could also play a huge role in how he acts and how he carries himself. There's also no overt signs of physical health problems, but Bobby does appear to have some psychological concerns and is notably dependent on his others and extreme emotional reactivity. His mom, Helen, shelters Bobby from the world and instills a sense of fear and low self-worth in him. She also is an unhealthy and controlling relationship with Bobby, creating an emotional and stunted developed individual of Bobby. It is also clear if Bobby's father is alive or you've ever even had a relationship with him, and he was obviously raised without a father figure. This absence could likely contribute to Bobby's reliance on his mother and poor ability to form other relationships with peers as other guys, because he never had a relationship with a father. Bobby struggles socially as well, as he has very few friendships and lacks social confidence. He is also bullied often by his peers and his teammates, both because of his awkwardness and inability to stand up for himself. He also shows interest in Vicky Valancourt, which he considers his girlfriend, but his ability to gauge in a healthy relationship with her is hindered by his lack of self-esteem, emotional immaturity, and dependence on his mother. Vicky doesn't mind his lack of social skills and seems to help better with him as they interact more. He also ends up playing for the Mud Dogs, where he ends up playing very well and becomes a fan favorite of the fans, and eventually creates some friendships with the teammates on his team. Bobby also has no education since his mother kept him out of school. As a result, Bobby isn't as smart, and he doesn't have any really social interaction with other peers, and he doesn't have the regular education as others and isn't as smart. But he does end up becoming the water boy for the football team instead and engaging in normal academic and social activities, because he has to be on the team, he has to have some sort of credits in the college. So there's that. And then for the diagnosis, firstly, Bobby displays symptoms of social anxiety disorder, as he exhibits chronic worry and excessive anxiety, particularly in social situations. His fear of rejection and constant rumination over his perceived inadequacies are consistent with the diagnostic criteria for social anxiety disorder. He also exhibits he consistently shows criteria of dependent personality disorder, his extreme reliance on his mother for emotional support, and he has no social support as well because of his mother, and the guidance and validation is a clear sign of dependency from his mother. Bobby is also unable to make decisions inadequately, often deferring to his mother for approval and acceptance. And then finally, Bobby's emotional dysregulation, characterized by aggressive outbursts when he feels disrespected or humiliated by his teammates when they make fun of him or anything like that, aligns with criteria for intermittent explosive disorder. And then for the treatment for all this, starting with family therapy, which would be crucial in addressing the dysfunctional relationship between him and his mother. This therapy would focus on fostering emotional independence by helping Bobby and his mother set appropriate boundaries. To address Bobby's issues with anger management, a targeted approach using cognitive behavioral therapy and anger management techniques would be crucial. His emotional outbursts, particularly in disappropriate reactions to perceived insults or disrespect from his teammates or any other or disrespects he gets from the football field stem from a lack of effective coping strategies and difficulties to regulating his emotions. And then lastly is social skills. This training would be focused on teaching Bobby the essential interpersonal skills such as initiating and maintaining conversations, reading social cues, assertiveness, role-playing. Exercises would allow Bobby to practice these skills safe in an environment area. And these could just help, like, getting to, like, even with Vicky, talking with her regularly and keeping a good relationship with his peers. Thank you.